I am Sheila Jourdain, and I am a board-certified psychiatric mental health nurse practitioner. I've been working in psychiatry or in mental health for over 20 years. The career really chose me. I didn't choose it. I've just always been a people person, and I've liked to help people, especially people who I feel are either underprivileged or at a disadvantage, no matter what that disadvantage might be. And that disadvantage might just be lack of information. So I think that's also what kind of makes me a natural teacher, so to speak, is like if I learn something, I want to share it. I want to share it with other people. And it's like, well, I didn't know that. Well, there might be a lot of other people who didn't know that either. Like I should share this information. So being a mental health nurse practitioner allows me to be able to kind of kill those two birds with one stone. I get to be around people, learn about people. It's such a privilege that people will, come into my office for the first time and kind of like finally take a deep breath and let their shoulders down, like they've been holding on to so much for so long, and finally come in and be like, I've never told anybody this. I've been needing to talk about this. I didn't know who to go to. I didn't know, what to do or where to go. And then they come in and just feeling good that I can kind of at least help to give someone direction. And through my education, through my nursing education, through my medical education, I was able to, learn about all the different tools within mental health and psychiatry and in medicine in general that I can kind of use to help educate people, to help them to be their better selves. So I've had a lot of my counterparts kind of ask me why I decided to start my own practice, especially after working in mental health for so long. I've worked, with a lot of other great organizations. But I really did get to the point where I felt like I wanted to give patients as many different options as possible. People have heard me talk over and over again about how each person is an individual. Each person is individual. We're not all one size fits all. And I didn't like feeling like I was working at places that was giving patients options, that was trying to force the patient to fit into the option instead of giving the patient options. You go out there and you can go to the grocery store, you've got 70 types of bread, you've got 30 different types of ice cream, so why is it in something that's so important like mental health, we try to limit the options that we're giving our patients? I didn't like that. So I went on my own. I started Augustin Psychiatric Associates, and it's allowed me the opportunity to be able to, as I learn different options, I'm able to educate my patients about those options right away. And TMS was one of those options. Ketamine-assisted therapy is one of those options. There's so many other options out there for different patients that I strive to continue to educate myself about, to become an expert in those different places and spaces, so that I can bring that back to my clientele as different options that they have to be able to treat and maintain their overall mental health and well-being. Because like I said, or like I say often, you don't have to wait until something's wrong, to get into therapy or to see a psychiatrist or to see a nurse practitioner. It's all about your overall mental health and well-being and your maintenance. The same way you don't wait for your car to break down before you change the oil. You already know that, like, I'm going to be driving this car every day. It's valuable to me. This is how it fits into my life. I need to maintain it. Mental health is the same way. You don't have to wait until something's wrong to decide to be like, all right, I want to maintain this. So I often get the question of why I decided to focus more on med management versus therapy. And the reason I focused more on med management, as I may have mentioned before, is because it is definitely a need. We don't have enough prescribers. We don't have enough people who are skilled and educated in the psychodynamics and the psychokinetics of medication, and really understanding different medications and what they can really do for patients. I found that as I was working with patients and learning about medications, I really just gravitated to that more. And I've always been the type of person where there's a need, that's where I want to plug myself into. So I found that there was such a need for prescribers, for people who really understand medications and how they work and what they do. So I really gravitated towards that. Part of my personality just naturally was like, all right, well, that's what's needed. That's what needs to be done. That's what people are looking for. And that's how I could be of service. So that's why I kind of really gravitated more towards medication management. Not to say that therapy doesn't go hand in hand with medication management, and not to say that one is above the other. Sometimes people start in therapy and get to a certain point in therapy where they realize, like, you know what, maybe medication management would be a great add-on to my current treatment plan. Or vice versa. I may get a patient who comes in and where they are, they're not ready for therapy yet, because what the medication can do for them to get their mind and to get them emotionally in a space where they can start to do that therapeutic work, we need to put that medication first and then bring the therapy in next. So everybody's treatment and where they start in their treatment is unique to their own situation. So they're both very important. I do use a lot of therapy in a lot of my medication management. It's part of how I treat my patients comprehensively. I'm looking at all different types of things with medication, and I'm looking at the fact that this is a whole person. I want to know the last time you had you went to your PCP and had a yearly physical. Yeah, let's look at your blood work. You're tired. Depression definitely has symptoms of fatigue, but so does an underactive thyroid. When's the last time we did blood work? Let's look at your thyroid. Let's look at height and weight. Let's look at your blood sugar. Does diabetes run in your family? Let's look at a bunch of other factors, because mental health is physical health. Physical health is mental health. They go hand in hand. So you can't have one without the other. So here at Augustin Psychiatric Associates, I really employ a comprehensive approach to all of my patients when I'm developing and working through treatment plans with them. So if you find yourself thinking that, you know what, I don't know whether it's medication management, I don't know whether it's therapy or not, I'm not really sure, we would love to have you. Give us a call here at Augustin Psychiatric Associates. Come in, let's have a conversation, let's dig a little deeper and see, let's work together to come up with a treatment plan and see where you want to go and how I can help you get there.